Hello and good afternoon, everyone. This is Dr. Amir Khan, and you're here for another episode of Khan Clinics, powered by American Muslim Today. Today's topic is about anemia. What are the facts? Have you been affected? Have you seen people being affected by anemia? And if you have been, what do you do? Do you understand? Is it important to know about anemia and stuff? So there's what we're going to start from. Our guest today, who's going to be talking a little bit more about anemia, is Dr. Safia Shahid. Dr. Safia Shahid is a graduate MBBS. She currently resides in Pakistan, and she'll be walking us through different aspects of anemia and its treatment. But before we go on to speak to Dr. Safia, we're going to play a little video and have you guys have a look at the stuff. So, Jeremy, go ahead and my friend play that video for us.
Why is our blood important? Pause the video here and try to think of some ideas. Our blood has many important functions, which can be stated simply as transporting substances around our body and protecting us from disease. Sometimes, though, our blood doesn't work in exactly the way it should. In this video, we will look at an example of this: anemia. Our blood is made of plasma, platelets, white blood cells, and red blood cells. If a blood sample is centrifuged, i.e. spun round very fast, in blood fractionation, this is what the sample would look like. As you can see, most of the cells in the blood are red blood cells, and it's these cells that make the blood look red. Here is a basic diagram of a red blood cell, or erythrocyte. Anemia affects this type of cell. Every cubic centimetre or milliliter of blood contains 5 billion red blood cells. They are very small. Each one is only an average of 7 micrometers in diameter. 1 micrometer is a millionth of a meter. Red blood cells have several adaptations for carrying as much oxygen as possible around the body. The biconcave disc shape means that it has a larger surface area. They are flexible, so they can move easily through small capillaries. And you may notice from the picture that it's missing an organelle, a cell part, that almost all other eukaryotic cells have. Pause the video and see if you can think what it is. It has no nucleus. This means they have more room for oxygen, which is carried by hemoglobin molecules. Anemia is the general term for having either fewer red blood cells than normal or having an abnormally low amount of hemoglobin in each red blood cell. There are several different types of anemia, and each one has a different cause. In this video, we will discuss 2. Pernicious anemia occurs when a lack of vitamin B12 or folate causes the body to produce abnormally large red blood cells that can't function properly. Sources of vitamin B12 include fish, cheese, chicken, eggs, red meat, milk, and almonds. Iron deficiency anemia, the most common type, is when there is a lack of iron in the body, perhaps from a diet that is low in iron or because of blood loss or pregnancy. People who have particularly heavy periods are susceptible to this type of anemia. Symptoms can include tiredness and lack of energy, shortness of breath, noticeable heartbeats or heart palpitations, and pale skin. This is all because the red blood cells that are made are smaller than normal and sometimes irregular in shape, meaning each cell can carry less oxygen. They will also appear paler when looked at under a microscope, and the symptoms are produced because the person's body cells do not receive enough oxygen for respiration. Doctors sometimes prescribe iron tablets if someone is suffering from iron deficiency anemia. Sufferers could also increase the amount of iron in their diet. Foods that are rich in iron include artichokes, egg yolks, red meat, dark greens, dried fruits, and legumes. So, now you know what red blood cells do and how they are adapted. You have also learned about 2 types of anemia and how they may be treated.
Please like and share our videos with your friends. If you have any questions that you want help with, just comment below.
Well, that was a fantastic intro. Well done, Rida, and the team did a fantastic job. Jeremy, you did a great job. We also have Maya in our studios with us. Dr. Safia, can you hear us? I want to have, yeah, that's okay. But we're going to fix it now. Find Safia because now 40 people are seeing us. Got no option. Bring that here and you'll just speak here. Okay, let's go live back again. All right, well, we have a little bit of a technical glitch in our system, and as a result we can't hear Dr. Safia properly, so she had to dial in and call us. And so, Dr. Safia, how are you today?
I'm fine, sir. How are you?
I don't know how well we can hear you, so you're gonna have to speak a little loud till Jeremy tries to fix your connection. Walk us through. Sorry about this little glitch. I know you've been preparing a lot for this presentation. Walk us through your anemia presentation.
So, hello everyone. My name is Safia, and today we are going to discuss about anemia, its causes, symptoms, treatment, and prevention.
Okay.
So, what is anemia? It is basically a condition in which the number of red blood cells or the hemoglobin concentration is lower than the normal.
Okay, so
in men, if it's said to be anemia if the hemoglobin concentration is less than 13.5, while in women if it's less than 12 gram per deciliter.
Wonderful. Okay. So the number that we need to remember right now is the 12 number for in general, right? Is that
Yes,
correct?
sir.
Okay, very good. And so walk us, what else is there for that? The 12 for women. It shouldn't be below 12 for men or women. Okay, excellent.
Yes.
Okay,
And for men it should be not less than 13.5.
okay. Very good.
So before going further, what is hemoglobin?
Very good.
So it is basically an iron-rich protein that attaches oxygen from the lungs and it carries oxygen throughout the body to the tissues to supply it.
Fantastic. So it's the iron part, Dr. Safia, you say it's the most important part. That's the part that we need where there's some iron protein, and that's what we got to focus on the hemoglobin, correct?
Yes, because it's the most important part in the iron.
Wonderful. Okay. So please continue.
So globally, 40% of the children are affected by anemia, while 30% of the pregnant women are affected by it, and 37% of the pregnant women are affected by it.
Okay. So just hold a sec. Do we have her live back on? Jeremy? Okay, Sophia, just walk us through. I think we can got you back on again.
Okay.
Okay.
So RBCs are smaller in
I'm
size in
just-
the microcytic.
I'm just going to disconnect from the phone line, and then we're just going to continue on the presentation front. Okay?
Okay, sir.
Wonderful. Thank you. All right. Let's see where Safia is right now. Can you hear us, Dr. Safia?
Yes, I can hear you clearly.
Fantastic. Okay. We're back live. Thank you for that. All righty. So we just got to the bit where we said two components were important for us. Is the hemoglobin that is relevant, and then the second bit was where we know that there is an iron that is somehow attached on this hemoglobin that is relevant to us. So what have you got next, Dr. Safia? Please, that was very nice.
So in the microcytic anemia, the RBCs are smaller in size, while
Okay.
in macrocytic anemia, the RBCs size are larger than the normal, and this is one of the way to classify anemia.
Gotcha. What is the normal? What's the normal? Are the micro and the macro mean that these are abnormal cells?
Yes.
So the normal,
So
from the normal cell, it could become bigger in size, and that's called a macro, or it can become smaller in size, and that is called a micro. Surely, when that happens, the effect of carrying the oxygen by the iron on the hemoglobin is affected. So,
Yes.
okay.
The normal size is mainly defined through the MCV. So the mean corpuscular volume for the normal RBCs should be in between the 80 to 100 femtoliter.
Gotcha. That's the normal volume. The mean, you say the mean C volume is between 80 and 100. Fantastic. Very nice. Very nice. Okay.
So
So that's
What
one way of
causes
classifying
anemia?
it. What about the other ways? Please walk us through others.
So the most important way to classify is according to the causes, and the most important in it is the iron deficiency anemia. Apart from this, the vitamin B12 deficiency can also cause anemia, and the folic acid deficiency.
So before we go on to the causes of anemia, Dr. Safia, if you were saying the hemoglobin is so important, and that we need to maintain not only a number of hemoglobin, which is about 12 or 13, you're also saying that the shape should look right for the hemoglobin. It should look right, and it should have the right amount. So does that mean we all need iron? Does that mean we all need iron?
Yes, we all need iron. Even the children, the pregnant women, men, women, and in the old age too.
So if we take too much iron, Maya, that could be a problem. But definitely if we take too little iron, that has sort of like a direct effect. On the number of the cells that are there. But secondly, Dr. Safia is saying mentioned about a volume that the hemoglobin has to maintain. And is there a number on how much iron you need? Who can tell me how much iron do we need a day on average? Do we need a certain amount of iron therapy or iron every day that we know? I know that you can find a lot of supplements out there that are, but on average, children need more iron than grown up because they're growing and the general recommended dose of iron approximate
13 to 15
yes between
milligram per day
very
for
good
this children.
very good. It's about 10 to 15 milligrams a day. That's absolutely right. So the iron should be a part of our supplement. Why? Because it affects directly how much oxygen you're going to carry. Why is oxygen important? Why do we need oxygen?
So we can breathe.
We can breathe, right? So if there is no oxygen, we won't be able to breathe.
Yeah.
If our body doesn't have any iron, would we still be able to carry some oxygen? Actually, it turns out that you can carry oxygen still in the plasma, which is you have iron, you have the hemoglobin, and then you have the part that is the water, so sort of like the fluid component of it. There are cells in blood, and then there is the fluidy part, and that's the plasma part. Problem with that oxygen going through that channel is that it's very inefficient. It's just not gonna meet the demands of but that doesn't mean that all of the cells are gone, you can't carry any oxygen. And sometimes we see that. How do we see it? When we have trauma patients and we give them massive transfusion, we give them a lot of transfusion, the RBCs keep on getting destroyed and stuff. So you need the RBC because they're an efficient way of getting the oxygen. Where do we need to get the oxygen to?
To the tissues and organs.
So which one is more important? Which one would you say is more important? The brain is more important? The heart? I know they're both important. Both are needed. So which one, if you had to, and I know this is sort of like it's like a little testy sort of question. If you're in a situation where you need blood supply to both, we need both, because you don't get it to the heart, you're going to have a heart attack, you're going to die. You can't function. And you don't get brain oxygen to the brain, what's going to happen? Like what?
Organs.
Well, first of all, no, not, in fact, that's very interesting. Your organs shouldn't fail immediately if you don't get oxygen to the brain. You immediately lose conscious. You're going to immediately become unconscious. When you become unconscious, what happens? You can't respond. You can't think. You cannot give you're not able to communicate to the outside world. In scientific sort of terms, it's very interesting. It's the same situation like you go to sleep. The basic definition of how sleep functions is pretty much same. You lose the perception of touch, which is the feel, which sense of seeing, sense of smell, hearing capacity, all of those. That's when you go into sleep. But then I'm saying if you don't get oxygen to you become unconscious, which is also like a little bit of a sleep. You lose the outside connection for a while. So but there is a difference. In sleep, you're getting still oxygen to the brain. So your cells don't die. When you do not get oxygen to the brain for any other cause, you got to make sure that there is a term called necrosis, cell death. Infarction is infarction when it's dead, infarcted, dead, and ischemic when the blood supply is low. So that's the distinct. One is a very reversible condition, i.e., sleep, and the other, if it persists, kills the cells, and there is permanent damage. So that's why when Dr. Safia is going through and she's saying, I need those cells to be not only pumping at a good capacity, which is the heart doing the function. It becomes very important. The heart is pumping everything. The cells need to be viable. The oxygen carrying capacity needs to be there. Hence, anemia becomes very, very critical. Hence, you could argue that if you are anemic all the time, is your learning capacity still the same? So that's what we're going to argue. Is your learning, and especially in kids, is their learning capabilities affected? We know when they're sleep deprived, yes, they're not as fresh, they don't get consolidated phases of sleep. There's going to be effects of that. But when there is when you're anemic, what are the implications then? Because the body, what will try to do is, the body will think that, oh, you're anemic, you're not getting that amount of oxygen, it's going to pump more. It begins to pump more, or it tries to compensate by making your cells either bigger in size so we can attach more oxygen to it. On average, there are, I think, 4 iron that are attached to 1 hemoglobin on average. There are 4, I think, iron molecules that attach to, but that sort of like varies in different conditions. And there are conditions where more and sometimes less get affected. So very, very important. I see that a lot of people responding to that. So brain, Maya, very important. You want it to reverse. It's not a healthy condition. And if you're anemic, your blood may be thin at times. If you think about it, if the RBCs are less, it's less viscous, or maybe more. Both of the conditions, and I hear a few people saying that they get affected. And then yes, your thinking capability, your cognition, you become more, besides the unconsciousness which you can have, you're drowsy. You're like, what's the term that I'm looking for? When you stand up suddenly, you become hypotensive. Syncopal, lightheaded, syncopal, just because your body has these shifts and they can't compensate for them. So I think she brings up, Dr. Safia brought up a very brilliant point. We're looking at also then what are the factors that are important to us. And I said one thing, we said, well, I do want you to remember the number 12. I think it's important. I do want you to remember roughly the number 12 milligrams of iron that you roughly need is another 12 number. There's a lot of causes of anemias, but there are certain conditions when you are affected more. When you may be affected more. So the two most important conditions are, when do you think you're affected the most? When you really need not to be anemic. In generally life and just throughout the span of your life cycle.
I guess when you're a kid, but also maybe if you have blood pressure issues.
Well, very good point. I think the first one is brilliant. Yes, one is when you are a kid. Why?
Because, like you said, they need more iron, right?
They're growing.
Yeah.
They're growing fast. Their organs need oxygen more. It's like the bones grow. You need, and that's what we see sometimes in sickle cell people, with patients as well, that they get affected. So when you're growing, your bones need it, your lungs need it, your eyes need it, your brain needs it. All are growing, all are vitally functioning, But what is the what is just generally in the span of life? There is a second um, condition just generally in life when you need a lot of iron, well, supplement iron, of course. When would that be?
Still answer from the chat. Say pregnancy.
There we go. Look, the team are very spot on. Yes. We see that Dr. Noor, Dr. Vijay spotted pregnancy. Why?
Because you're growing another human inside of you.
Yeah, there you go. It's the same thing. It's another actually kid.
Yeah, exactly.
That's demanding. That's demanding that. Was there someone gonna check up and see how much oxygen, iron do we need at that time? Then, I know we get supplements if you're iron deficient. So generally, if your diet is less, Dr. Safia is gonna explain us, and that's what she's gonna try to explain. You could be diet deficient. That's the condition number one. You could be consuming more iron. We just discussed pregnancy because here, or kids, because they're consuming more. In pregnant women, they're also consuming more iron and they become iron deficient. Or you're losing iron. Third condition. These are your three most important condition. Your diet is low, intake, your consumption is high, pregnancy, you've had splenectomies, there is squashing up certain spleen, it sort of consumes all the red blood cells, or there is hemolysis going on, which is you're losing red blood cells. They're being hemolysis by parasites or infections is the other thing that they could consume all the red blood cells. So you're actually bleeding, or you're bleeding. You're losing more. That's a common cause. You're losing more, or you've had from the blood or the veins, you're losing more oxygen. So that's what Dr. Safia is going to explain further. So that's how I want you to think. Well, you guys think of the causes of anemia. When you are analyzing something, you know, hey, where is the numbers and stuff coming from? All right. So, Dr. Safia, please do follow up on that and explain it to us. What are the different causes? And I just wanted to put that in so we're clear going forward. Very good. We have Dr. Fatma saying you need 120 mics according to the WHO. So the pregnancy, it brings up another little point, and I just want to mention this while Dr. Safia is going to explain her, and she's going to explain a little bit about the pregnancy, and we discuss how infection and you're deficient. If you're having heavy periods, you're going to become deficient, or you can become deficient. And that's another, it's also like you're losing more blood. That comes in the same category as you like bleeding sometimes, and a lot of times you're anemic, you're actually bleeding through your bowels. You have a lot of times they have hemorrhoids. People have hemorrhoids. They could have internal bleeding. There could be bleeding going on in the body, but you're bleeding from somewhere. So the bleeding can be in different forms, and these are not fast, but we call subacute, slow bleeds. Dr. Safia.
Yes, apart from this iron deficiency anemia, the heavy menstruation can lead to the anemia as well because of the excessive blood loss. And
Perfect.
plus that the infections, especially the worm infestations in the children, because it impairs with the nutrient absorption, that can lead to anemia as well.
Very nice. So walk us through your causes that you have put up there. Very nice. Your deficient is one. You mentioned that
And pregnancy-related anemia.
pregnancy-related anemia. And what about the infections, Dr. Safia?
The infections include the prolonged infections, the chronic one, which include tuberculosis, HIV, and the parasitic infections, which include schistosomiasis and ascariasis, because they basically reside in the intestine and they like impair with the absorption of the iron in the intestine. So obviously, iron cannot enter into the body to make the hemoglobin.
Oh, brilliant. Okay. So there are certain parasites, infections that will prevent iron from getting into your body because they're consuming them themselves. They like the if you get a hookworm infection or a hookworm inside, they like iron too. So they want to eat the iron whatever you get. And as a result, you're not getting the iron that you need. And that could be a sign that you have a problem, especially in kids. If you don't wash your hands and somehow, and for kids it's very hard. And I tell that to, when we had COVID, I tell all of the patients that we had, for kids, two important things, that measures you should do. Have a hand sanitizer at two places in your house. One is at the entry door. And guess where the second one should be? Probably, where else? Another place that is very critical. Kids often miss, and God, brilliant. Yes, kitchen. That's where we want it. I know you want them to wash their hands, and I know you guys all tell them wash it, but honestly, I even sometimes forget to wash my hands, I'll be honest. But if I've got a hand sanitizer right in the middle on my table now, and I just squirt it there, and I know I've used it before, I'm actually, it is as good, if not better, using than washing your hands. It's actually even better because it kills all the germs and stuff. The only problem with, it's actually not a problem, but soap is a little bit alkaline, so it damages your skin a little bit less. The hand sanitizer, but hey, if we're eating 2-3 times and we're washing every time our hands, and it's on the table kitchen, so two places, very critical for all the mums that are out there. Just note your entry, where the main door. As soon as they put the bags and stuff, put one hand sanitizer there. They enter the room, enter the house. That's one place. And then the kitchen, other big place. Yes, I think the bathroom, you always have something there. So two big areas, guys. That's what you want to focus and keep an eye on. Yes, I saw that some of them had already said, yes, kitchen is the second most important. And I agree with that, everyone. Okay, Dr. Safia. So you said infection. We don't want to bring infection from outside. What do we do if there's malaria? I know this is not a big issue here, but Maya, what about if there is malaria?
To me, it is we have mosquitoes.
You have mosquitoes. So if you find a mosquito, what are the preventions you're going to do? Let's see if we can identify what are the preventions generally for malaria if you see a mosquito. You're seeing a mosquito, you're worried about it, and now you wanna do, what are the preventions? Okay, kill the mosquito. Yeah, go around and find your spray. But what if there are quite a few of them? Actually, in Texas, I see that in the evenings, especially in summer, there are a lot more than the mosquitoes as compared to when I was in Toronto or in New York.
Texas my whole life. I know about mosquitoes.
We got
They're
mosquitoes,
scary.
but they got mosquitoes. But they may not always be malaria carrying mosquitoes. So I'm hearing here people saying different things. Net is a big one. Using a net, using a skin protector is the second biggest one that is coming up. All right, then people are saying you should be wearing proper clothing. Oh yeah, that's a big one. That was Pfizer saying that. Very nice. Very. Pardon me?
They will find the area of skin.
They will find the area. Yeah, they're very smart. Okay, Maya is spot on. They still find your area. Actually, where do they like to go for? Where you everywhere. Me also.
The veins.
Yeah,
The blood.
yeah, I agree. I know a lot of women, they like the women blood. I don't know why. Sometimes it's like they say, when I'm there, they'll say, oh, I don't know why you're immune. They don't bite you, blah, blah, blah. Although they do bite me now, they do something. But maybe it's not as much as they bite. They like this. They say, they like more sweet blood. They like the sweet blood, Maya. I'll tell you. That's probably what it is. Yeah, women's blood, they want to Dracula it. The Dracula bite or something. So you want to cover. You want to put a net on. You want to put a skin propellant on. But there is another big thing that mosquitoes like. I've got, let's see. Mm-hmm. Water, yes. They love water. That's the thing, yes. Yeah, I see comments here. Women are sweeter, so they have sweet blood. That's interesting. That's what I find it interesting. Men are not sweet, so they don't have. Jeremy, you're out. You probably turn into a Dracula at night and want to suck blood, like, right? Oh dear, oh dear. Because you think about it, Dracula is always a male. There's never a female Dracula, right? Is there?
The mosquitoes that bite you, they are females. They're always females.
Oh, they're always females. Okay. All right. Okay. That's interesting. I wanted to know that. So they like, okay, very good. So malaria is very important, and then that Dr. Safia has called that. But the other problem is when they bite you, that parasite gets into your body, and the parasite likes your blood, even inside. The mosquito likes the blood. Then the parasite that goes into your body, that likes the blood, and then it bursts your red blood cells. And when they burst more red blood cells, more parasites are released. They go into more red blood cells, and then they want to burst more, get into the red blood, and all of them start to burst more cells. So it becomes a domino sort of effect, and that's why you have to get to the bottom of it. Once you're bitten, it's too late. You have to get treatment. You have to find out. And that's why Dr. Safia's presentation is very important. It's an important cause of causing anemia. And anemia like this is very fast. And besides anemia, when you have a fast destruction sometimes, you also can become jaundiced as well, secondary to it. All right? So just on that note. Okay, yes, absolutely right. Because the term that the medical term they use is called hemolysis, like someone just said so. It's called hemolysis. We have some very smart people there. Very good comments coming. Environment management is the other one. I love that one. Is that how do you control? Yes, as a general, you can't have stagnated water outside. You know what I'm saying? It's very important. If you have a bad stagnated infestation of malaria, you have a big problem. No matter what you do inside is not going to help. And especially if you've got bitten. Now if that malaria bug if you get bitten again, it takes that blood and bites someone else, and that blood goes and gets bitten again. And there's the very different types of malaria are very, 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 very aggressive. Let's put it that way. And we've seen very easily people getting into trouble, and then sometimes the diagnosis can be very hard when it becomes advanced or something. All right, so just remember that. So malaria, Dr. Safia, and then you mentioned HIV as a cause, parasites as a cause, TB as a cause. It's a little bit TB being a little bit different because there's so chronic infection going on, and you don't want to eat because you're on medication, and you always you're feeling miserable all the time. So it's probably more like a diet-induced thing that you don't want to eat, and then your body absorption isn't as good because if TB is affecting your intestines, you have a problem. Because one would think, why would TB affect it? But you could say now HIV is also a very interesting one, because HIV patients can have chronic anemia. These are chronic anemias. They're not like a fast anemia, all right? They're chronic disease anemias, and it's a little bit of a different. They're a lot of times microcytic type anemias. Okay, very nice. Dr. Safia, please tell us more.
So, in addition to that, there is the vitamin B12, which is also needed along with iron for the production of RBCs, and its deficiency lead to vitamin B12 deficiency anemia.
Oh, very, very important. Dr. Safia, do explain us a little bit more of that. You've just brought up a very important vitamin. Now we know that we needed iron and now you brought up a vitamin that we need and the B12 that need. I know there are a lot of vitamins, but how much do we need? How much do we need to take the B12? There's a lot of supplements, I know.
So basically, vitamin B12 is absorbed through the intestine, and vitamin B12 is mainly needed for the DNA production in the RBCs. So if it's deficient, then RBCs cannot form in the proper shape, and it leads to the anemia.
Excellent. Okay, yes, and I see some of them saying that they lead the anemia, and some saying that it also causes specific macrocytic type, which is important. So, excellent. So we need iron, and we need a vitamin now, because you're saying you're gonna have few things, and we need this folate as well, right? Which comes a lot of times with the iron. So how much? About, I'm going to defer that, but ask you in a bit how much do we need. So yes, adults, is this
So
something
actually,
that
in adult and children, the ranges varies. So in adults, 2.4 to like 3 microgram is
of
needed
folate?
of B12.
B12. Okay. Well, that's okay. Well, we see that there's a oral form, which now they give sprays of vitamins, which is very interesting. And the dosage, we're gonna have a look at that, and it varies because sometimes they're saying that you need about 500 micro grams, and it depends on how much, whether it's oral form or an injectable form. We'll have a look at that, and it generally is saying is about 500 to 1,000 micrograms a week that you need, but it varies. But yes, okay. So there is a certain amount we need. Generally, is saying you need the recommended RDI dose for people over 14 is 2.4 mics. 2.4 mics is the other recommended dose. We're gonna look that up a little bit. Okay, I think it's 2.4. Your NIH is saying the same as well. Fantastic. Okay, so let's look at that. 2.4, 1.5. That's what I'm getting from the doctors group now. And the 500 mics of folate. Okay, fair enough, Dr. Safia. So we need these are vitamins we need, which is very interesting, right? Why do you need a vitamin? We talk about, we need a vitamin. There you go. You need it because you need it in your iron, which goes in your blood, which goes in the cells, which carrying oxygen. Excellent. Okay, next cause, Dr. Safia.
So the next cause is the hemolytic anemia, in which this is a specific condition which may occur due to infections, autoimmune diseases, or it may be inherited, in which the red blood cells, when they move through the bloodstream, they break down, and it leads to the hemolytic anemia.
Okay. So this is cell death inside the body. All right. And hemolysis. Okay. Well, Jeremy's waiting for put the second video up. So, Jeremy, show us what you've got, my friend, as the next backup thing.
Anemia is extremely common, affecting nearly 1/4 of the world's population. Depending on the severity of the anemia, oftentimes some may not show any symptoms in the early stages. But for some with existing conditions, they can present with more serious signs and symptoms. Women of all ages are at special risk for iron deficiency. Children need extra iron during growth spurts. Females of childbearing age lose blood during menstruation, with some losing much more than average, which is often referred to as heavy menstrual bleeding or abnormal uterine bleeding. Pregnancy also increases the woman's iron demands. Iron deficiency anemia can have serious adverse health consequences for the mother and child. Other conditions may cause bleeding, such as uterine fibroids, gastrointestinal bleeding, and ulcers. In infants and children, even mild anemia may delay mental and motor skills development. For patients undergoing surgery, both preoperative and postoperative anemia is associated with increased complications and increased exposure to blood transfusion risks. Ulcerative colitis, Crohn's disease, and gastric bypass surgery are frequently associated with anemia. Reported rates vary widely, but at least 1/3 of patients with irritable bowel disease have iron deficiency anemia.
Dr. Safia, did you see that? That was fantastic, because I think you've covered most of the things from that presentation. I think you're going to bring home a very good message for everyone. I think even if we don't take anything, you guys are going to take a lot of good little points from this. So let's have a look at your next slide. I think it's very important. Before we put up your next slide, let's just ask the audience and see what if, and I know we got doctors, we got a pretty smart audience here, and then, but I want to ask them, what are the symptoms that they have seen of a patient of being anemic, not dehydrated, anemic. I see some of them are not answering that much, but now this is sort of like a general question. Have you been anemic? Has anyone been? And if they've been anemic, what have they seen? And I know there is a lot of men and women, but more women in the audience, so they can be affected more generally, and that's why they say it's a staggering figure when they say, oh, 1/4 of the world population is affected, and in some of the countries, half of the kids are affected in one way or during a growth spurt or something. So that's very, very staggering. LLC. So the common one that has come up, that they are tired fatigue. Tired fatigue is one. Okay.
Can I ask, is bruising easily a sign of anemia? Because I feel like whenever I was in high school, especially, and like doing drill team, girls would be like, oh, I'm anemic because I bruise so easily. Okay, I guess.
Very interesting. The simpler answer is actually no. Bruising is another sign. You are deficient. Well, there you go. I think you're right. You bruise because you could be bleeding, which is, or you have a clotting factor abnormality, meaning your blood doesn't clot well. So when anything touches it, it bleeds easily. So it's a different mechanism. See, when you bleed, you have to form a primary plug and a secondary plug. The primary plug goes immediately to the site, okay, and it stops the bleeding. And then slowly the more organized plug gets to the place. So the primary plug is like a platelet plug, and the secondary plug is more like a fibrin, organized, and it stops all the bleeding. If you for some reason cannot quickly get that plug in, you're going to bruise easily. So a lot of things can do that, affecting the platelets, affecting the blood vessel, medications, what you're on, platelets having deficiency is important, but it's not really the anemia caused that what they're looking for. All right, so that's a brilliant question. I think that's a brilliant question, and we do, and I know we're asking questions, but we really want to also have you guys ask questions while that's the main thrust of this. When we discuss, okay, we see that people saying, oh, there's heart, and we got some brilliant responses here. You could be short of breath, that's a sign of anemia. You could have headaches, that's a sign of anemia. You could have heart palpitations, can be exacerbated, and that's a sign of anemia and stuff. And you see people eating stuff that make you anemic, and that's very important as well. So a lot of stuff. So thank you for asking that question. It's very good. If anyone has any questions so far about the anemia, I mean, I think Dr. Safia has done quite a brilliant job and just going over all of this, but do put your questions in. We are looking to answer any myths, anything that surrounds anemia, anything that you want to discuss. We are keeping an eye on that. So, Dr. Safia, do bring up your slides. Let's see what Dr. Safia says. I know you guys have got, all of you have put up very nice comments in this, and I agree with all of them. I don't think there's anything that you're saying is wrong. Dr. Safia?
So the symptoms which a person may observe if he or she is suffering from anemia is person may feel dizziness, fatigue, fainting, or palpitations, and the shortness of breath whenever he or she tries to do some work like climbing stairs or any exertion work.
Okay.
And the signs include the yellowing of the sclera, the paleness of the skin, the coldness of the extremities, and the low blood pressure.
Very nice. So we could feel dizziness, we saw fatigue, fainting, palpitations, heart rate, chest pain is also, if you're anemic too much, you put in, you could have a heart attack, you could have a large, and then the signs we see, what we look for, you could have the yellowness, the paleness, and then you could see signs for shortness of breath, and the muscle could be weak, the skins could be affected, they become whitish in color, and very good. Okay, I think that's very excellent slide, Dr. Safia. Okay, next, let's see in the next.
So in addition to that, so the diet history is very important to diagnose the type of anemia. Like either the person is taking the iron-rich diet or not, vegetarian or not. The family history to like differentiate from the inherited anemias. History of any chronic infections, as we have discussed earlier, and the menstrual history, especially in the young girls.
Excellent. So taking this, asking these questions are very important. I think the other question that she's brought up is very interesting. How many, let me ask a general question, and it may vary from place to place. How many of you out there are vegan?
I was vegetarian for 3 years.
Oh, I'm glad that we have someone in the studio, because I want to know, first of all, do everyone know what a vegan is? Let me just ask the audience. Does everyone know what that is? Because I've got no one, Maya, other than you, who has tried the vegan diet. Woo!
Vegan is different than vegetarian. Vegan is you don't eat any animal products.
Okay.
Vegetarian is just you don't eat meat. I still ate eggs and cheese.
So vegan diet is when you're not doing animal,
products.
and vegetarian is obviously you become now vegetarian completely. Okay. So I see no one except probably one or two come up and say I have. They are non. So are you a non-animal, meaning not eating animal, vegan, become non-animal, or are they vegetarian? I bet they're gonna say, most of them are gonna say they are like vegan, more towards where non-animals than being strict vegetarians. Okay, that's what I think I'm gonna see. I've got so far probably a few. I don't think Abdullah is a vegetarian. That's one of the guys saying, I'm a vegetarian. Come on, don't tell me that. I'm not gonna believe you if you say that. I think you're just trying to impress all these girls here that you're at. Don't do that. Right? Yeah, Abdullah. I know a person who's doing that, but you're saying you're a vegan. You're not a vegan. So is there, let me just say this, who's a vegan. Say here. Is there anyone? I got two, actually 2, 3, 4 people so far saying I'm a vegan, non-animal. Tell us how your experience was. I want to ask, because this is very important. We're gonna, and I've got a few people reach out to me and say, oh, we want to do a separate session on diet and talk about diet and what is a carnivorous diet, what is a vegetarian diet, what is a vegan, and we got someone in mind who we're going to call and who's going to discuss this. But tell us your experience, Maya. You were a vegan.
Vegetarian.
Oh, that's even strict.
Vegan is stricter because vegan you don't eat any animal products. Vegetarian I just didn't eat meat, but I still ate eggs and cheese, which vegans don't eat eggs and cheese.
Whoa, so that's it.
Those
So
are animal
vegan,
products.
vegan is like you're
And
just
vegan-
going zero.
Yeah, vegan can also be more of a lifestyle than a diet because vegan means no animal products. So that's like
So
leather,
it's not only meat and stuff, animals, but it's the products as
anything
well.
from animals, yeah.
But you were more vegetarian, and then you allowed yourself to have milk,
yeah, dairy.
eggs,
Mhm.
and stuff. I bet no one is vegan in the group. Other,
I think vegan is being harder.
however, of course it is. Not
I
going
know,
total
like-
ban is like,
Yeah.
oh my God,
Yeah.
is like I'm not.
I just have
And
one
I
friend
got,
who's vegan.
pardon me.
I just have one friend who's vegan. She's the only person I know who's like vegan.
Oh really?
Yeah.
And
She likes it. I mean, she's done it for a long time. She's my age and she's done it since high school.
and what did she say? What's good about it? Why does she like it?
I don't. That's an interesting question. I don't really know why she likes it, but she does. I mean,
She just likes that lifestyle, so where she thinks animals I'm not gonna touch.
yeah.
Anything from animals, which is completely opposite to. There's another very popular diet out there. It's called the carnivorous
The
diet.
meat only, yeah.
Well, they don't say meat only.
But-
They're more like a carnivorous diet, and they go with everything. That's so one spectrum, the vegan, and then the carnivorous diet being the other spectrum, which is all meat products. And actually, I have a very close friend, and he, oh, I don't know about that, but he can swear that has changed his life.
Honestly, I think it has to do with genetics because I know a girl who did that for a time, and she said it helped her. It helped clear her skin, and like a couple other.
That's
things.
one of the biggest thing I get from the carnivorous diet, and I'm putting this out there because diet is such a big thing in even the Desi community. If I'm calling that the Bollywood, Hollywood, and that we are living on another planet. Honestly, we have no idea about the diets types and what should we do, because I'm gonna ask everyone again: are there any vegetarians in the
Starving, you're vegan.
vegetarian?
But
First
that's-
of all, for vegan, some said no. Now you know the definition.
But just you-
Who is if you are, just write vegetarian. I am vegetarian or I am vegan. Now you know the difference. Why has this explained this? Vegan, zero animals, zero animal products. Vegetarians, you're still vegetarian, no meat, but you can have milk, you can have eggs, you can have their products, but you're not having the milk, the meat itself. And the vegetarians don't eat chicken.
Yeah, I didn't eat any chicken, any fish.
So you did that for 3 years, and I'm gonna get a response from that in a second. Is to say, is anyone a vegan or a vegetarian? And I know so far I've got zero saying either. So you become a little bit. I thought a few of them said, yeah, we
No, but just
I like.
Abdullah, what he said.
Hmm.
You'll starve in a Desi household. That's the same thing for Hispanic households. They consider meat in everything.
I know.
All dishes are meat.
I know.
So yeah.
So that means when you do it, you have to change the culture around you.
everything.
It's not that you cannot do it if you're the only. It's very hard to do. See that diet thing.
I did it in East Texas. Do you think there's any vegetarian options in East Texas?
I am sure that must be very, very hard.
It's hard. It's hard depending on where you are. Yeah.
And so tell us. So you did it. I'm still finding for someone if there is anyone. Someone said no, no, no. I want everyone to say no. So at least I know everyone said no. And then I'll find someone saying yes, and I would love to speak to that person or just get an idea. But most of them saying no vegan, no vegetarian. But what was your experience? Why did you do the vegetarian?
Honestly, I did it because meat kind of started to gross me out.
Okay, I hear that a lot.
Yeah.
I hear that for some reason you heard a story about a meat, how a chicken got killed, or a cow, or the brutalism, or a lot of time I hear this, how brutally they are, and it's a life, and you feel sensitive in your life for something, and it could be just a part of your life, that you get affected by it. But so then what happened? So you maintain
like
it.
I said, it's hard because it's not as convenient as eating meat. Eating meat is just more convenient because you have to go places and get a special order or find somewhere that has like good options that's not just like French
So, but
fries.
you did it because you got grossed out. Do you feel any different now versus when you were a vegan, in terms of number one, your performance? That, let's say for just general work performance or your lifestyle. Did you feel more fresher then? Did you sleep better? Did you feel that you were your skin was better, or you felt that your eyesight or anything? Have you tried it, by the way, my friend Jeremy? No, you like meat, yeah.
You know,
Yeah.
I really didn't notice a big difference between
The
being
vegan and-
vegetarian and not being vegetarian. honestly.
Okay,
So
okay.
that's why I said I think it's really. When
It was a
comes down to
choice.
diet, yeah,
It was a
It
choice.
was a choice.
Having coming back to that, our topic is that when you're doing a lifestyle like this, and we're going to discuss this a little bit more. I know I think I've got 20. Some of the people are responding, some are missing still. I think at the end of the day, we're going to have a little bit more chat about this, because what you don't want is you want to not be obese.
Right.
And the point here with Safia's presentation is you don't want to be deficient either.
Yeah.
You have to have your essentials. And yeah, that's very important. I think those two things. Dr. Safia, do you agree?
Yes.
You agree.
So iron is the most important thing, so it should be included in our diet.
You should be included in the diet, and I agree. Okay, well, let's look at the next slide. I know we're running over time again, and we're going to try to sum it up a little bit. Dr. Safia?
So in addition to that, there are specific investigations which could help to identify the type of anemia, and it includes complete blood picture, the total iron binding capacity and ferritin levels for the iron deficient anemia as well, vitamin B12 and folate levels, and hemoglobin electrophoresis.
Excellent. Okay, next.
So before going towards the treatment, what could be the main reason in children to have the anemia? So the main reason is the unbalanced diet, the one in the adult as well, the iron deficiency, which is not sufficient with the iron, and with the diseases like the parasitic inflammations in children lead to anemia.
Excellent. Okay.
And towards the treatment, to eat the iron-rich food is the most important thing, as we all know till now that iron is the most important part of the hemoglobin and its need for the production of hemoglobin and to transfer oxygen to the tissues as well.
Okay.
So the iron-rich foods include the green leafy vegetables, the dried
Excellent.
fruits, nuts, shellfish, lentils, and seafood.
Okay, excellent. I think that slide is very, very important. That's a no. Probably everyone should try to see if they could take a picture and try to see if you're not a meat eater, then you try to get your essentials from somewhere else. And I think the vegetables and some fruits there are very important. Broccoli always comes up. It's considered to be a super broccoli, and I don't know how much of, again, I don't know how much it is in the Hispanic culture or the diet, but Maya, again, in the Desi diet, it's not existence. Broccoli, such an important, and just generally vegetables. When you just mention vegetables, people say, what do you cooked it?
They're cooked in.
You want me to starve?
Spices.
Yeah, they want to say, you want me to starve today? You cooked vegetables? You know, it's like a taboo. It's considered, I don't know what it's considered, but every time they say we'll talk about the vegetables and the superfoods, the vegetables come up. All right, very, very interesting. Okay, Dr. Safia. Next.
So this is one of the slides showing the iron-rich diet,
Yeah.
which is similar to the last one. So let's move to the next one. In addition to that, the iron supplements could help to
Okay.
treat the iron deficiency anemia as well.
Perfect.
While if the person is suffering from vitamin B12 deficiency, there are supplements for that along with the folic acid.
Who takes, and I want to ask the supplements, who takes regularly, and I just want to try to get an idea from the audience, I know a lot of the audience is young, so I want to try to get to who takes supplements, and I just want to see a vote, and sort of like an honest opinion from everyone. Supplements could be multivitamins. They take multivitamins and stuff. In my age, it is to say, oh, you should take a men's multivitamins. It contains vitamin C's and vitamin D's, which are essentials, and then some zinc, folate, iron, which is a combination. So that, or some of the women saying, oh, I do take them or I don't take this. So who takes? It's not just specifically iron, but just vitamins or a supplement, a multi supplement of things. Who takes them? And I know it's not just, again, I'm emphasizing, not just taking iron is not a good supplement. And that's why, well, let me rephrase that. Taking iron is absolutely fine, but it's not considered a multivitamin source of stuff. If you come to me and say, I'm taking vitamin D regularly, when I'm sure in certain countries you don't need it, but what about vitamin C regularly? Or how much do you need it? When we know it's in fruits, we know it's important for healing. Or what about vitamin A for eyes? Are we taking it enough? So I see very few people saying, oh, I take multivitamin. I know Safia is saying yes, and some are saying, so we absolutely need to discuss supplements and vitamins and multivitamins and what we should be taking. Dr. Safia, and I'm going to discuss that with the group, with the diet and stuff. Next.
So there are specific treatment for the different types of anemias according to the cause. So to discuss one, there is a sickle cell anemia, and to treat that we need the drug hydroxyurea and oxybreta.
Perfect. Okay, next.
So if the pregnant woman is suffering from anemia, she may have increased risk to infection, the preterm labor and the postpartum hemorrhage. While in the child, it may lead to the anemia of infancy, low birth weight, prematurity, and the neural tone tube defect if the person is suffering from the folate deficiency.
Brilliant. Okay, next. And I think the prevention, I think this is the last slide. I think the prevention is the key. I think we're just going to leave that one up. And I think diet and getting the source for it is very, very important. Dr. Safia, I've got to apologize. We've ran out of time again. Excellent presentation. Thank you very much for joining us and just sharing your knowledge with everyone. I'm sure a few of you or a few of them are going to take a few messages home. I'm just getting the last question up. What are people taking as a supplement again? And I'm seeing some are taking B12. I'm asking, are they taking some multi-source vitamin? And I do want to discuss this. Some are saying, yeah, I know vitamin C and D, but is there anyone taking it religiously, regularly? And I've got some answers like, oh, I'm taking B12, or but they're just taking B12. Why would you be just taking B12 of all the vitamins and not anything else? But I'm going to discuss that later on, and I'm going to put that up. Okay, Jeremy, what we have a winner from last time. We had put out a question about, and I think the best answer came from Dr. Fatima Zahra. Fatima Zahra gave the best answer. So she is the prize winner for this week. So she, and you can see her response on the blog. It was considered by an independent panel, nothing to do with Dr. Khan. 3 panelists, or 2 panelists at least I know, but a third panelist judged her to do a response which was which was mostly from our discussion, and it was a non-GPT, chat GPT or a Gemini response. So Fatma, well done. Congratulations on putting up that best blog. So the question for next week that the team have put forward for you guys is, how will you identify anemia in pregnant women and kids? All right, this is very interesting. How is it different? How is it different from the others? We've discussed this. And how would you manage it? I know we're going to talk about it a little bit. How do you know when a kid's anemia is starting to having anemia, is growing, or a woman is pregnant, and in pregnancy you identify, oh, you're now anemic and you're not taking enough supplements. So how are you going to identify it? How are you going to treat it? And how is it different? It's a very nice, simple question. So we're looking forward for your entries by the end of the week. Mind you, we want you to put your entries. The newer system is going to have, you could share your responses on Facebook. You can share it with other friends or family members. Anyone can send a response. The question should already be up. So anyone can send their response. It doesn't matter if it's your uncle, your niece, your nephew. If it's a child or a kid watch this presentation, they should put their age and please put their response and leave an email at the end. All right. I think that's what the important thing. Leave out your email contact so we have a source so we can contact you back and be able to. And if you win the prize, you'll be able to get a certification as well as your prize money going to it. And however you want to get it, we'll get it across. So that's very nice. So please submit your responses in time. Next week's topic is gonna be about chest pains. It's a very interesting topic. Dr. Maha is gonna discuss this with us. Chest pain and heart attacks. We want to discuss when someone's having a heart attack and what do you need to do? Maya, if someone's having a heart attack in front of you, what would you do? How do you know he's having a heart attack? So it's a very interesting topic. We're going to discuss that next week. With that, I want to sum up. Thank you very much for everyone joining us. I think the important thing is please don't forget to subscribe. I think we want you to make sure that you put a like signal on the YouTube channel. I've only seen 3 so far. That's not good. Guys, we need your help. The team, I want to thank Rida. I want to thank Jeremy, who's always stressed on Fridays, and Farhana and the other social media team, including Hamza, and Maya. Thank you, Maya, for your discussions and giving us another insight about the discussions. We want to see you next week. Please bring your family and friends as well so they can have a discussion with us. And don't forget to put like I said, the comments in this is very, very important for us, and share it with your family, friends. Have a good weekend. We'll see you next week. Thank you very much.